The coronavirus pandemic is rapidly changing how people live, and it's putting new pressure on personal behavior that can affect others, like when this pandemic first hit. And a Tennessee man was basically eyeing a business opportunity, as he viewed it, buying up 17,000 bottles of hand sanitizer, trying to make a profit by reselling them on Amazon. You may have heard about the story, which drew a huge backlash, which then led him to back down, donate most of the stockpile, and even offer a public apology.
If by my actions anyone was directly impacted and unable to get sanitizer from one of their local stores because I purchased it all, I am truly sorry for that.
Now notice something here. That public health dilemma was not addressed by the government or the police. That man was not fined or arrested. He was basically swiftly corrected by peer pressure. We're now seeing a similar dynamic as the weather warms up and some public spaces are filling up. Some people now criticizing and trying to shame people who appear to be violating these rules, both online and in person, with public shaming. Then, of course, there are the efforts to shame the powerful. Vice President Pence leads this virus task force. He visited the Mayo Clinic last week without wearing a required mask that the other medical staff wore. But the public criticism and swift shaming led him to say he was wrong. And he was conspicuously then wearing one 2 days later at a ventilator plant. So shaming can work, can even foster public health when deployed thoughtfully. Now, let's be clear. There is an obvious difference between shaming a random civilian and a very powerful official running virus response. There are also some more subtle differences that we probably need to explore between shaming, say, extreme sweeping conduct, like depriving a whole neighborhood of the needed sanitizer, versus overreacting to a single person taking a walk on the beach. Now, researchers called a more enlightened version constructive shaming. Professor Jennifer Jacquet is an expert in this field and notes in a new piece that shaming an institution can be quite effective, writing, "The mayor of New Haven recently shamed Yale University, his alma mater, for refusing to allow the city use of their dormitories for medical first responders, stressing the nearby University of New Haven had said yes in the first 5 minutes. Wait for it. Soon after, Yale reversed its decision." That from the piece, Public Shaming Has Only Just Begun, and its author, NYU Environmental Studies Professor Jacquet, joins us right now. She's also the author of the book, Is Shame Necessary? And for the medical perspective, we are also joined by Dr. Megan Ranney. Good to see both of you. Thanks for being here.
Thanks for having us on, Ari.
So, Professor Jacquet, let me start with you, having worked in this area. We walked through some of those examples, including courtesy of you. What makes for the most effective shaming for public health?
Yeah, thanks. I mean, this is such a fruitful time for shame. And I think we all know how common it is in our daily lives and how uncomfortable it is right now. It's really easy to shame behaviors that are clearly observable and where there's a clear transgression. So you have, the gatherings of 10 or more, or the social distancing of 6 feet or more, or wearing a mask as really obvious points of behavior for shaming. And I think you pointed out some people feel like shame has gone too far in some of these circumstances. There certainly are some problems there, and I don't want to minimize those, but I think there's a lot of opportunity with shaming, and you've made some of those points already. But this is a long fight, and we have a lot of opportunity to deliberate. And we need to be thinking about who is leading us really into harm's way, aside from just our neighbors at this point of time. So I think it's up to smart people like you, Ari, but also, a broader conversation about who do we want to shine the spotlight on and for what purpose and how exactly.
Right. And that's what we want to dig into. I mean, it's important what you say, particularly the nuance, and the doctor will weigh in as well. I want to look at one dramatic public shaming effort that you kind of got to see to believe. It involves the Grim Reaper. Never someone you want to see, on a Florida beach with a self-proclaimed activist in Grim Reaper clothing. Take a look.
Daniel?
Thank you. Yeah, I'm here today to try to make a point that we need to, I think it's premature that we open our beaches. I think that the danger of bringing all the people here to our area and spreading the virus. And I think it's going to prolong the recovery we have. It's too soon, and it's not appropriate.
Thank you, Daniel. Now, Daniel is going to be beginning his protest right now, and he's going to be at a bunch of other Walton County beaches throughout the day.
Now, I'll mention for viewers who may have just joined us, fact check, that's not literally the Grim Reaper, but it was someone trying to kind of dramatize this. And so I guess first the professor and then the doctor, what is the best way for people to think about what works versus kind of overdoing it?
Well, I really like that example. It's a great one to choose. It's shaming a broad, sweeping behavior rather than a particular individual. So there's no clear victim of the shaming on the other end. And it has a kind of nice artistry to it, cleverness. You know, we're sort of chuckling at it. So I think that's really great, again, for informing that kind of personal behavior. But I'd like to see a little more strategy in terms of bigger bang for your buck. I liked how you called out the whole state of Georgia recently, you know, for opening up too soon and putting its citizens at risk. And I think there's an opportunity, as the congressman was saying in the last episode, they're wanting to push a bill through for emergency expansion of Medicaid for people who've lost their job and health care, and to shame, I think, politicians who don't support that bill in a clever way, perhaps not a Grim Reaper way, but something of that ilk. And and that kind of broad strategy that would help maybe the nation as a whole rather than just a particular beach in Florida.
Doctor, what do you think?
So I think the history of public health messaging shows that shaming, or reframing it, changing social norms, is tremendously effective in changing behavior. Jeremy Faust and I wrote a piece that was published in Slate yesterday talking about how we can change that public messaging effectively. And a big part of it is creating a normative meaning among our communities that we expect each other to behave appropriately, that we expect each other to practice social distancing, we expect each other to wear masks. And you can think about that happening on the level of leadership, as Professor Jacquet just talked about, right? So it can be about trying to get Trump or Pence or governors to demonstrate that they too wear masks, whether or not they're infected. But it's also about all of us as individual communities having those discussions and reinforcing with each other that that's what we expect each other to do. You know, you can think about it like with drunk driving. Back when I was a kid, drunk driving was talked about as bad, but we didn't take people's keys away. We didn't create that kind of norm that you're expected to call an Uber or to let someone else drive. And those norms changed thanks to public messaging, thanks to the examples of influencers and celebrities, but also thanks to those changes within the community where now we would no longer accept one of our friends getting in a car after they've had a little bit too much to drink. And that's what we need here too. We need people to no longer accept that people will walk out in public without a mask, or that they'll go and sit right next to each other if they're not members of the same household. So changing those social norms are just critical for creating change and protecting our country.
Yeah, thinking about the history of other social movements that intersect with medical safety is a good example, Doctor. And as we quoted, I mean, Professor Jacquet, I thought what you wrote as well about the public institution stuff is important. This shouldn't devolve into a question of people just posting pictures of other random people and beating up on people who basically have very little agency or authority right now. But when you talk about a public health institution, a university, the vice president, there's a lot of avenues where it can be, as you put it, constructive. We're just starting the conversation. I suspect we will be discussing this more in the days ahead. Professor and Doctor, thank you both.
Thanks for having me.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.